Hi everyone, my name is Stephanie Enriquez and my group, America Castillo, Amber Garza, and Daniel Gomez and myself will be presenting on the pros and cons of popular diets and the effect that they have on aerobic and anaerobic performance.
Abstract. As humans, we need nutritional intake in order to survive. The importance of implementing essential nutritional components to our everyday lives can impact our overall health. The popular diets are carnivore diet, ketogenic diet, intermittent fasting, paleo diet, and vegan diet. Nowadays, we live in a world that runs off capitalism, and people claim that specific diets make our bodies thrive to its fullest potential. They mention big eye-openers like fat and weight loss and muscle gain. Should we believe those claims? Who's credible?
So you may be wondering exactly what are these diets? Intermittent fasting diet consists of eating patterns with periods of eating and periods of fasting not eating. A ketogenic diet consists of reducing carbohydrate intake while increasing fat intake to help with rapid weight loss. A vegan diet is basically switching to plant-based foods, being fruits and veggies, which is said to help the environment and individual's health and improve animal life. A carnivore diet is the consumption of protein such as meat, fish, chicken, and or other animal foods like eggs and certain dairy while excluding everything else. A paleo diet consists of lean meats, fruits, veggies, nuts, and seeds. So you may be wondering, what is fasting? What is a fasting pattern? There are periods of eating and not eating. Each fast is unique of the type and time of the fast. There could be types when they're born into just life. There could be religious factors into it and or seeking health benefits from intermediate fasting. I found an article that discussed fasting during Ramadan. Studies have shown improved insulin sensitivity, improved glycemic control, and improvement of lipid profiles during Ramadan when individuals were fasting. There are even differences on specific fasting diets like a dry fast or a water fast. A dry fast is fasting without liquids for the entirety of the fasting period. Water fasting involves the elimination of anything with calories, allowing for those partaking to continue to consume water and only water during the fast. We found that with dry fasting, it reduced inflammation levels and improved cognitive function by improving neuron protection against brain dysfunction and degeneration. Dry fast leads to a 50% reduction in glucose and insulin-like growth factor. Dry fast also led to improved bone health by PTH, parathyroid hormone, which aids with bone growth and maintaining optimal bone integrity, is elevated when you fast. We are going to be going over two articles that discuss the pros and cons of intermediate fasting. The metabolic effects of intermediate fasting review found that modified fasting regimens appear to promote weight loss and may improve metabolic health. The overview suggests that intermediate fasting regimens may be a promising approach to weight loss and improving metabolic health for people who could tolerate intervals of eating or eating very little for certain hours of the day, night, or days of the week. The other article that discussed the health pros and cons of continuous versus intermediate calorie restriction diets found that overall health effects of intermediate fasting in the study will increase lifespan, decrease mortality from cancers and cardiovascular disease, reduce oxidative stress and inflammation. It's important to note that intermediate fasting on reproductive health can have a potential detrimental impact on reproduction and particular bone health because when pregnant, the body relies on the energy available in the body. It may be beneficial for overall health and well-being, but the lack of properly designed clinical studies make it challenging to formulate evidence-based recommendations on intermediate fasting. Now we will be discussing the pros and cons of intermediate fasting in athletes. It's important to note that the human body during the fast state, insulin levels fall and the body burns the stored glycogen and fat. Intermediate fasting helps with fighting depression and anxiety during a fasted state because the body releases ghrelin, a hormone associated with elevated mood. The specific effects on performance and muscle strength. We found that intermittent fasting does increase growth hormone, which enhances lean body mass, but it does not improve strength and may even reduce exercise capacity. It's also important to note that endurance training in a fasted state can facilitate more rapid reactivation of muscle protein translations. The levels of protein kinase that indicate muscle growth was doubled compared to those during training in a fasted state. We will continue discussing intermittent fasting on the effects of performance and muscle strength, and that endurance training in a fasted state increases the capacity for fat oxidation in trained muscles, but feeding before, during, and after each training session might have other potential benefits. It's very important with intermittent fasting to know the time and type of nutrition. We also found that endurance training in a fasted state could have metabolic advantages, but feeding before, during, and after each training might have other beneficial factors like we just stated. So it's important to know the type and time of nutrition. Ingestion of protein and carbs shortly after weight training sessions enhances muscle protein synthesis and muscle accretion. So with resistance exercise training coupled with food intakes results in elevated insulin levels, which in turn promotes more protein synthesis. So it's important to note during a fasted state or a non-fasted state. Lastly, the cons of intermediate fasting. We know that when starting this diet, it can cause headaches, mental and physical tiredness, and exhaustion. We know that people on medication for blood pressure or cardiovascular disease, eating disorders, pregnancy, people that are underweight, and subjects undergoing blood transfusions should not implement intermediate fasting into their diet. It can have a detrimental effect on the body. In female athletes with high levels of heptacin, a hormone that regulates iron absorption, the high levels inhibit iron absorption, and possibly due to inflammation, they should not fast. Pitfalls of intermittent fasting are that there is no evidence to also support the claims of weight loss, and feeding regimens should be derived and based on individual patient factors, according to Baer in 2018 on intermittent fasting. To conclude intermittent fasting may be beneficial for overall health and well-being, but the lack of properly designed clinical studies make it challenging to formulate evidence-based recommendations. Endurance training in a fasted state does increase capacity for fat oxidation, but having meals before, during, and or after may have other potential benefits. And it's important to note that intermittent fasting can cause tiredness, exhaustion, and headaches. People who are pregnant, underweight, and going through blood transfusions should not implement the intermediate diet.
So the ketogenic diet, also known as the keto diet or a low carbohydrate diet, was discovered in 1921 when it was used as a treatment for epilepsy in children and adults before any anti-epileptic agents came about. So basing off of a 2000 kcal diet and referencing the ketogenic diet, which consists of decreasing your carbohydrate intake, this is somewhat the breakdown of the macronutrients. So 55 to 60% is going to be fats, because when you decrease your carbohydrate intake, it is recommended to increase your fat intake to now switch from depending on carbohydrate as your energy to fats. So 30 to 35% is going to be protein, and 5 to 10% is going to be carbohydrates. So in grams, this translates to about 20 to 50 grams daily of carbohydrates. So every diet has its upsides and downsides. So the pros and cons of the ketogenic. Basically, the most popular and probably what the ketogenic diet is mostly known for or most popular for is because it helps with rapid weight loss. So anyone looking to lose weight quickly can get into the ketogenic diet. Also, some studies do show that it helps the body adapt to other energy sources like fat instead of just depending on carbohydrates. However, some cons of this diet are that while you reduce the carbohydrate intake, and yes, it may help you lose weight, it may also increase an individual's LDL level, which can be lethal. And since the carbohydrates are the main source of energy for the body, being deprived of these will cause a chain reaction of events which will lead the body to enter a catabolic state. And studies have shown that there is a decrease in performance outcome in endurance running athletes due to their decrease in carbohydrate intake, rather than comparing them to athletes who maintained a high carbohydrate intake. The athletes who stayed on a ketogenic diet showed less performance than those who stayed on a high carbohydrate diet. So continuing on my previous slide about the cons of the ketogenic diet, I just wanted to say again that as the body's carbohydrate consumption is drastically decreasing, the body will enter a catabolic state. With this, gluconeogenesis and ketogenesis come into play. So gluconeogenesis is genesis, the production of, so the production of glucose in the liver, because there is a presence of alanine, glutamine, lactic acid, and glycerol, which are amino acids. And then ketogenesis is the creation of ketone bodies. So basically, this comes into play when the body's glucose needs exceed the body's glucose production. So basically, the body can no longer keep up with the glucose needs that it's asking for. So they create ketone bodies, which are considered the next best source of energy. So a quick disclaimer for this specific diet. As any other, especially related to the intermittent fasting, it may also cause nausea, dizziness, vomiting, and headaches. It can also cause an individual to fatigue quicker when exercising, and it may cause constipation. So any individual who suffers from diabetes specifically, but not limited to, which they can have, suffer from pancreatitis or liver failure, should talk to a doctor before participating in this kind of diet, because if a diabetic's insulin medication is not appropriately adjusted before they start this keto diet, it can lead to hypoglycemia. As we know, the entering a ketogenic diet can decrease the glucose production, so this may be a problem to diabetics. To conclude talking about the ketogenic diet, I just wanted to say that it can be a great choice for anyone who is healthy enough and is looking to lose weight in a quick manner, I guess you could say. You could definitely rely on fat-rich foods and reduce your foods that are high in carbohydrates. But I did want to add that every body is different, so as it may be helpful to one person, it may not be helpful to another person, even though that they're trying to do it or they're doing it exactly as they're told to be doing it, because every body composition is different. Also, just to conclude what I mentioned previously on athletes, this keto diet can be helpful to endurance athletes, which helps their bodies adapt to change, basically. So it may be hard, it may decrease. Sometimes studies have proven that it does decrease their performance, but other studies have proven that the ketogenic can help the body adapt to changes. So basically, since the body is no longer depending on carbohydrates, it's going to depend on another source for energy, basically on fats. That's what I'm trying to say. So it's going to help the athlete's body adjust properly. And just one last thing, that whatever the reason is that you're following this diet, make sure that it's what's best for your body and you're doing it for the right reasons.
Carnivore diet pros. The carnivore diet is a great solution for a short-term diet. The diet aids in many things such as short-term weight loss, mood issues, blood sugar regulation, and other health issues. Because meat is rich in nutrients such as vitamin A and B, iron, amino acids, zinc, fatty acid, and some minerals, this has many benefits. The diet removes foods that provoke inflammatory response, which also helps in the reduction and remission of autoimmune diseases, better sleep, more energy, pain reduction, again, short-term weight loss, improved cognition, and the reduction of bloating and digestive problems. Pros continuation. Meat usually contains an acid called conjugated linoleic acid, also known as CLA, which helps with the prevention of obesity, cancer, diabetes, atherosclerosis, and osteoporosis. An article called Salt Intake from Processed Meat talks about how a lot of meat being processed is now having a higher percentage of sodium. The pro to sodium intake is that sodium plays a big role in the maintenance of membrane potential and is essential for nerve transmission and muscle contractions. It also helps regulate blood pressure and volume in the human body. Carnivore diet cons. Although sodium intake was a pro, high sodium intake can also be considered a con. High sodium intake leads to the absence of sweating, high blood pressure, then leads to hypertension, strokes, and myocardial infarctions. Saturated fats are also a big part of the American diet today. High levels of saturated fat being consumed is not good because it leads to higher levels of blood cholesterol, especially LDLs, which are considered the bad cholesterol. Because of this then leads to a higher risk for heart disease, stroke, and heart failure. Cons continuation. Because the carnivore diet is focused on nothing but protein from meat and animal foods, the elimination of fruit and vegetables can be dangerous, especially in the long run. People who do this diet for too long are losing some nutrients that they cannot get from meat. This in turn leads to cancer, and the consumption of too much protein can lead to calciuria, which affects the bones and leads to bone loss. The body also uses a certain amount of protein within one's body. Due to the large amount of protein intake, the excess protein is disposed by the liver in a process called glucogenesis, where the protein is turned into glucose, also known as sugar. Also, because the proteins are being substituted in the place of carbs, this promotes an increase in mortality rate, inflammatory pathways, and oxidative stress. Carnivore diet conclusion. In conclusion, the carnivore diet has many short-term benefits, and it helps aid in such things as short-term weight loss, pain reduction, mood and sleep issues, and helps with many other health problems. The carnivore diet is not a diet meant to be kept long-term. Although there are great pros short-term, there are also many long-term cons, such as cancer, heart disease, stroke, and myocardial infarctions.
Hello, my name is Danielle Gomez, and today I will be presenting over the paleo diet. So what is a paleo diet? The paleo diet consists of foods that were only available to humans before the establishment of agriculture, farming, or processing. So within this diet, individuals will eat of lean meats, fish, vegetables, fruits, roots, eggs, and nuts. What they cannot eat are grains, legumes, dairy products, salt, refined sugar, and processed oils. This part is the trickiest part because a lot of individuals struggle to determine what foods are included and excluded due to the fact that this diet is supposed to be based off of what our ancestors ate before you could farm and process stuff. Along with being referred to as the paleo diet, you'll also see this one referred to as the Paleolithic diet, the caveman diet, the Stone Age diet, or the hunter-gatherer diet. So now we're going to look into the benefits of the Paleolithic diet. Due to many benefits that result from the following diet, the popularity of it among athletes continues to grow. Based on multiple studies that have been conducted, it has been proven that a paleo diet promotes weight loss, heart health, longevity, and even benefits those individuals who suffer from MS. In addition, people who adopt this diet often saw improvements in blood sugar control, blood pressure, glucose tolerance, insulin sensitivity, and cholesterol profiles. When it comes to athletes, this diet has been proven to aid in the reduction of inflammation along with reducing the risk of iron deficiency. Like every other diet, there are also the cons, which is what we're going to talk about right now. For this diet, the cons aren't too detrimental for the body. One of the major things that individuals are concerned with is the elimination of entire food groups, which may lead to a decrease in energy, fiber, and protein intake. Since this type of diet excludes dairy products. That's one of the biggest concerns that a lot of people have. In addition, food portions for this diet exceed the recommended daily allowances for those food groups. This is mostly important when you see the fruits and vegetable food groups because this diet consists of those mainly. Lastly, this diet doesn't account for the wide range of foods that were available during the Paleolithic period since people and animals have since evolved. Therefore, it's not that accurate on what our ancestors actually ate. It's just kind of like a basis of what they ate. When looking into the Paleolithic diet, I came across several different studies that looked at different aspects of the effects that this diet had on athletes or individuals in terms of exercise. So the first study that I looked into was conducted on sedentary women, and it lasted over the span of 8 weeks. The study had a strict, detailed exercise program that was to be followed in order to record accurate data that they were looking for specifically. Within this study, the researchers found that there were improvements in cardiorespiratory fitness and relative VO2 peak. However, there were no differences in anaerobic or anaerobic exercise. The second study I found looked into the Paleolithic diet and how it affected exercise in individuals with type 2 diabetes. So the researchers had the subjects follow a Paleolithic diet for 12 weeks, and in addition, they made them combine the diet with standard exercise sessions and supervised exercise sessions. For the results, they found improvements in fat mass and metabolic balance due to improvements in insulin sensitivity, glycemic control, and leptin. They also observed an improvement in cardiorespiratory fitness through the addition of resistance training and aerobic exercise. The last study I found looked into how the Paleolithic diet affected certain health indicators and health and physical capacity within professional athletes specifically. And this one went based off of short-term and long-term usage of the Paleolithic diet. So based on the data that they found, the researchers found that short-term usage improves health status indicators, metabolic markers, and body composition. Regarding physical activity, it was observed that the Paleolithic diet helped individuals decrease fat mass, body mass, and waist circumference. So within this study, they determined that short-term usage of the Paleolithic diet was more beneficial than long-term usage. And an overall conclusion of the Paleolithic diet is that it does help anaerobic and aerobic exercise, but it's only when the diet is followed to the T, meaning like you have to follow the diet correctly or else you're not going to see the results that they saw within these studies.
Now we are going to discuss the pros and cons of a vegan diet. If a vegan diet is good and carefully planned out, it can meet all essential nutrients. If implementing a vegan diet, you should implement B12 since it's a compound found in only animal meat. Studies that said that a vegan diet can lower cholesterol and people are less likely to have high blood pressure. We also found no difference on exercise capacity for vegans, lacto-ovo, vegetarians, and omnivorous recreational runners. Now, I had the pleasure to interview a traveling nurse named Miss Castillo, and we asked her some questions about exercise and nutrition. Every human body is different, and we all have different motives on health. Some individuals have underlying conditions while others do not. Every diet does display pros and cons, but there isn't just one perfect diet. We encourage people to use this research and investigate the pros and cons according to their health. We conclude that diet should be individualized to the patient, client, and himself. Okay. Hello, Miss Castillo. Thank you so much for coming into this interview. I want to start off with that. Thank you for your time to be here today and conduct this interview. Today, I'm just going to be asking you some questions about exercise and nutrition. I have like around 5 questions to ask, and I guess since my main paper is going to be talking about diets, I want to see how important is exercise science to you personally.
Okay, whenever you're ready, we can start with the questions.
Yes. So my first question would be, how important is exercise science to you? Do you think it's very important for the body, or?
I believe it's very important for every individual's well-being. If applied to a health problem, it helps maybe not cure the chronic illness we have, but it betters it and it can prolong our lives. Now, there's people that really can't, but there's a small amount that can be done. So honestly, in every aspect, just to be healthy, even without illnesses, it is a very important part of our lives. And so I think it's very, very, very important for all of us to exercise, and it helps with to promote healing in general. So if we don't want to get sick,
There
let's
you go.
exercise.
So then would you say, is nutrition important for the human body as well?
Yes, very nutritious. It doesn't just promote healthy pregnancies, but normal growth in the children when they're born to, I mean, actually to elderlies. Because if the elderlies don't have good health, then they're just gonna, their health will just go down the drain. So yes, nutrition is a very important part. It plays a huge role
Yeah.
in our lives.
Awesome. And would you say, is there such thing as a perfect diet in this world?
I don't think there's one perfect, depending on our health in general, but I believe that there is one close to where you have a good amount of your nutrients, your proteins, carbs, fats, vitamins, and minerals, except too much fat in a bad form, like dairy, can harm you.
Mm.
But I believe high in fruits and veggies, that, like I said, low dairy, whole grains, nuts, fish, poultry is one of close to being perfect, but not perfect, like I said. And it depends on the individual's health, if they're diabetic, if they're hypertensive, if we're promoting wound healing. But nutrition, if you don't have good nutrition, no matter how much you work out or exercise, you're not going to be healthy. So it's very important.
Awesome. Okay. And do you think a specific diet would facilitate a specific exercise performance in the human body?
Yes. Let's take in consideration athletes. They need carbs. They don't have enough carbs, then they can't, uh, well, they'll compete, but they won't do their best. So we need that glycogen to turn into energy. And
Mm.
if we lack that, then they're going to be pretty sluggish. Um, the body also needs the carbs, you know, for just a daily, not too much. We tend to eat a little too many carbs, but and a well-balanced diet will help you perform better in anything you do, not just exercise, but in anything.
Vitamin specific meat intake or
Exactly. Now you have to be very careful with your meat intake, because not all meat is good for you. If it has too much fat, you have to take in consideration there's a lot of steroids being used in animals nowadays. So we have to, the best thing would be high fruit, high veggies, and I mean, we can get our carbs from vegetables. So we don't really need that red meat. Is it good? Yeah, it's delicious. Is it good for your body or your gut? Not really. So it just, you have to be smart about it.
about where your nutrition is going to be put
Yes, and it helps your muscle growth and repair too.
in.
So it's
All
there.
right.
Okay.
And the last question would be, have you been in a situation with a patient, since I know you visit a lot of patients throughout your day, that their diet has either improved or diminished due to their health?
Yes, both improved and diminished. I have diabetic patients with pressure ulcers, diabetic ulcers, where they don't want to stop eating their high carbs, their candies, their cakes, their little desserts with all this sugar, and their wounds won't heal. As it is, diabetics wounds take forever to heal. And if they don't eat correctly, then that wound will take even longer. Now I've had patients that eat correctly, and well, most of my patients are wound patients. So they start eating healthy, they take more the vitamins, not just their wounds start healing, but their blood pressures go down, their blood sugars start going down. So I've seen both, and it's very important. A lot of the time my patients can't exercise too much, but I tell them, even if they, as long as they eat correctly and they can walk a little bit, we're on the right road to recovery. So I've seen them both.
Wow, that's very good to hear. I mean, I feel like with this paper that I'm doing that I discussed to you about, I feel like diets are very important and nutrition is very important. So thank you so much for taking your time to give me knowledge about diets and what you have experienced. And thank you for your time for being here. I really appreciate it.
You're very welcome. You have a great day.
Thank you.